Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you. Welcome back to Between Two White Coats, and I am super excited today to have Kathy Hatmaker as my second white coat. I will say, little shout out to Amber. We love and miss Amber. She is definitely doing some Jesus work right now, as she is the chaperone for a bunch of 8th graders in Washington, D.C. So praying for Amber, and I'm sure she's having a great time. Yeah, I'm sure she's having a great time. Kathy works here with us at Our Family Health, and she is a nurse practitioner. She has, I'm going to cheat and look, 24 years of experience in healthcare. She has worked in the emergency room in one of our local hospitals for a long time. And then we were so blessed to have her join our team, where she covers our urgent care a little bit with all of her experience in emergency room coming forward. But she also has almost 14 years of experience in doing medical aesthetics. And so you are incredible to me, because you will run on one side of our wellness center and see somebody who has strep throat or COVID. And then you put on your different hat, and in the afternoon, you may go over and make people look gorgeous because you have such a diverse skill set. Tell me, there are lots of routes for how medical providers get attracted and pulled into aesthetics. What was your road to finding aesthetics?
Well, I had just genetically had a railroad map across my forehead and started early with Botox, and I loved the way it made me look and feel. So I decided I wanted to do it myself.
And I think a lot of times people, we go into healthcare and we're like, I'm going to save lives. I'm going to do all this,
Which is fun.
Which is absolutely important. And, but I think helping people feel good about themselves is also a remarkable part of what we can do. And I think when we do something for ourselves and then we feel good,
absolutely,
we recognize that we want to extend that to other people. And so you've been doing aesthetics for many, many years. And so today's episode is going to be to help people understand a lot of the different medical aesthetic services that are available. Some people are engaging in these things and they may not understand exactly what's happening. Some people are maybe thinking, I'd like to try that, but have a little bit of fear or concern around it. Don't really understand what it is. Might have a little fear on, what to expect. So we're just going to do kind of some frequently asked questions to better understand some of the more common aesthetic services. And all of these aesthetic services that we're talking about, we offer here, that Kathy helps people to enjoy the experience and look gorgeous through these different services here at our clinic, in our wellness center. So I'm going to list through and ask you some questions, and you're going to help me better understand some of the different services that we offer. One is carboxy facials or carbon dioxide facials. And first, even before we get to the carboxy, you really helped me when you said that you try not to call things facials all the time, because it creates a impression for someone that they might be getting more of like a day spa facial as opposed to a med spa facial. Tell me a little bit of the difference between when people think, I'm going to go get a massage and a facial at the day spa, which are wonderful things that we highly recommend, that I love, in case anyone's wanting to buy me a Mother's Day gift, hint. But what is the difference between that kind of facial and the kind of facial that anyone might get at more of a medical facility or a med spa?
So a facial, if you go to a spa, usually that's the outer epidermis. If what we do is a little deeper. So we're basically doing collagen induction therapies that a medical professional would have to do. It's a little deeper. It's not often a feel good. Sometimes we have to numb you to get to a deeper level. But your results will be longer lasting. You'll have better results.
I think that's super helpful because estheticians who work at day spas are licensed to do really more superficial,
Yes.
where you don't have to have as much extensive medical training and can do no harm. And there are good benefits from doing those superficial treatments. Then people who have medical training are licensed to be able to go beyond that surface layer of skin and do more penetrating, and so that it can get to those under layers and get the collagen to wake up. And so when you say these are like collagen inducing, so that people understand really what we mean by that, collagen is a word that's used in dermatology and on commercials and with so many skincare products. Collagen is in our under layers of our skin, and it's part of our connective tissue, and it pulls things tight. And so it's really part of like a lattice work for our under layers, dermis, and under the dermis to help pull the skin tight. We have lots of collagen when we're young, and it keeps everything nice and youthful and tight. And then collagen gets lazy over time. And so things don't stretch and rebound throughout our body as much as when we're young. And that's when skin starts to have wrinkles. So one of the natural ways to help get rid of fine lines and wrinkles is to induce our own collagen to wake up and reproduce. So when we say collagen inducing, we're really trying to wake up and get more of our own collagen, and our own collagen is going to pull things tight. So one of the facials that we do that helps induce collagen is a carboxy facial, or also frequently known as a carbon dioxide facial. Tell me a little bit about that.
So carbon dioxide is something you already have. It's natural in your system. The carbon dioxide is injected with a needle, and it's great for under the eyes. You can do the entire face. It helps relax the fine lines, wrinkles. It's also great for scarring. So if you have scars on, a lot of women have scars on their abdomen, they're self-conscious, this fades those scars.
So carbon dioxide is what we exhale, and brilliant people have found that if we inject it just under the surface of the skin, it creates a reaction that helps generate collagen, helps pull some of the fine lines tighter, helps with sort of that puffiness and crepey skin, puffiness under the eyes, or the sunken kind of bags under the eyes.
And dark circles.
And dark circles under the eyes. And then also helps with scar therapies as well. And so less invasive, a little bit of, do we numb before we do this procedure? Or
not normally. If they want to be numbed, we'll numb.
Pretty well tolerated, is not just, an uncomfortable.
The size of an insulin needle.
Okay, tiny little needle. And so it might feel like little pinches?
Yes.
Is this something that is kind of a one and done, and then we're done with fine lines for the rest of our life?
With
kind of hoping you
most
say
things,
yes, like I could get this done once and look 20 for the rest of my life, but that's not really how it works, is it?
With most procedures, you need 3, and then 3 to 6.
And so we space those by about how much?
A week apart.
And I think it's important for people to realize, because many times different medical facilities and aesthetics facilities will sell this as just one, or they'll sell it as a bundle. And really, I think most places sell it as one. And I know we talk about it because if people are a little gun shy and they're not sure, am I going to like this? Am I going to be able to tolerate this? They might not want to buy multiples at one time when they don't really know what they're getting yet. However, it is our strong encouragement to do more than one, because you're not going to get the maximum therapeutic benefit by just doing it once. You got to do things over time to really get this collagen to wake up and be stimulated.
And it takes 90 days for that cellular turnover. So you see your best results at 90 days.
And I think that is an excellent thing to know too, because if you are doing some of these things for an event, maybe we all know that when you're in someone's wedding, your face goes on their wall for the rest of time. I've been married 25 years. I have wedding pictures up at my house. If you don't look good on that day, you're going to look at it forever. So if you're doing something like that, you want to do a procedure to have you look good for that. So really you would want to work backwards and really say 3 months prior to that event is when you would want to be doing these things.
You may see results 2 to 3 weeks, but your maximum results will be in 90 days.
So doing a series of probably 3 to 6 over the course of 3 months, but you're going to get those results, and you space them by a week to get your 3 to 6 or so, and then you get the maximum result over time, because you're waking the collagen up, but it takes collagen time to be produced. And so we get it to do something now, you're going to see it in 3 months. That's excellent advice for people who are trying to figure out, I've got a wedding, I should do it the week before. Don't do it the week before. You're going to need more time than that. So those are carboxy or carbon dioxide facials. And Kathy has said to me before, and I think this is a really important point, carbon dioxide, what we exhale, what plants give us, very natural, important gas. Carbon monoxide, really big difference. So that small, it can sound the same. Carbon monoxide is what goes into the air and can suffocate and kill people, and it is a toxic gas. That is not what we're working with here. Entirely not what we're working with here. Something else that's come up that we're hearing a lot more about is microneedling. And microneedling is part of the very popular vampire facial. When I say vampire facial, I do want to let everyone know that that is actually a copyrighted phrase that people are familiar with. But what a vampire facial, and good for the people who figured this out and gave it a name that everyone wanted to repeat. But what it actually is what we call a PRP, a platelet-rich plasma facial. But that's really gotten a lot of hype. I think, anytime the Kardashians talk about something, we all talk about it. Yeah. And so this is, it's been big in Hollywood, and a lot of people have been talking about it. But microneedling being the first step, and then the PRP being the second step. So first, let's just talk about what is microneedling, and can microneedling be done by itself without the PRP? How does microneedling work?
So microneedling is a device, and it has 20 microscopic needles, and it glides across your face and it again is a collagen induction therapy. So you may have some redness when you leave. And it may last 2 or 3 days, but it opens those channels for you to receive products that are beneficial to your skin.
So with the microneedling, we're creating tiny little holes, opening these channels. So you're not going to look at anyone and see tiny little holes in their face. But we are creating these little channels that allow us to get different things beyond the surface layer. And if we look at really what is skin, the epidermis of the skin is 7 layers, with the outer layer really being kind of this dead, keratinized, protective layer that makes us waterproof, so that when water hits us, it doesn't just absorb in and make us float. But it's a very protective layer. The purpose of our skin, really, the epidermis of the skin, is to protect everything under it. So when we want to get therapeutic chemicals beyond that outer layer, we really have to do something to disrupt the outer layer, because the purpose of the epidermis is to keep things from absorbing in. So we're doing this little disruption of the outer layer so that we can get the therapeutic chemicals down deeper to the area where they're going to have more of an effect. And some of the things you can use. So the microneedling itself, when we do this little trauma to the skin, the little trauma is also therapeutic.
Yes.
We allow chemicals. Our body says, hey, something's happening out there. And so it sends the healing, and it sends the decreasing inflammation, and it sends everything that we would normally to get the healthiest version of ourselves to the area. So that little trauma is therapeutic. Then we've opened these channels to allow different therapeutic chemicals to get past that outer layer. And so sometimes we could just do a microneedling treatment, and that's going to be helpful. Adding whatever therapeutic skin creams are also going to be helpful, and it's going to induce the collagen. It's going to decrease the inflammatory markers and help people have healthier skin, tighter collagen, a healthy glow. Fine lines get kind of pulled out from the microneedling itself. Now let's add, we say
the
more
PRP.
about,
Combine it with the PRP.
So what exactly is PRP?
Platelet-rich plasma. So we take your blood and we spin it, and then we take your platelets and we place it on your face.
Platelets are an incredible cell that nobody knows about. Typically we think of platelets as helping to stop bleeding. But platelets are anti-inflammatories. And we'll see people's platelet levels go up when we're fighting off infection, when we're decreasing inflammation. Platelets, the platelets that are in the blood, and when we centrifuge or spin down the blood, we get this top coat of plasma, just plasma. We get this middle layer where the platelets live. It's called the buffy coat. And in that is a whole bunch of cytokines, which are anti-inflammatories, so therapeutic. We can inject cytokines in places and things heal and they grow and stem cells will reproduce better. Cytokines are extremely therapeutic. And then the bottom layer of the blood is the red blood cells. So what we're doing is extracting out that very therapeutic buffy coat that's rich in platelets, rich in cytokines. Then we create all those channels with the microneedle, and then we smear on the person's buffy coat of their blood, your own blood, your own platelets.
So we do it at the same time. We're doing it at the same time.
Okay.
So as we microneedle a section, we have your platelets in that area, and then we put it on top of there after. So you're getting 3 layers of your platelets.
And so we're really
doing the
extracting
procedure.
all the healthy anti-inflammatory from your own blood and putting it onto your face so that then your face gets this extra healing, decrease inflammation and puffiness, stimulate collagen, lots of different ways that this is what in Hollywood, in Beverly Hills, they originally called this the PRP facelift, because they were saying that this is a great way to do a non-surgical facelift because things got pulled so tight that it could look as though you had a little mini facelift. This is a one-time treatment, a multiple. How do you get the best therapeutic benefit from PRP?
So you can do one treatment and see results, but we recommend that you do 3 because you get your maximum results.
And how
especially
long would
if you
we...
have acne scars. This is the #1 FDA approved treatment procedure
to decrease acne
to
scarring.
decrease the acne scarring,
Which is huge. So that's life-altering stuff. How do you space the treatments?
They say every 3 weeks.
Every 3 weeks. Space it by 3 weeks.
FDA approved for every 3 weeks.
And get 3 treatments total. And when would you get your maximum therapeutic benefit? If you had that wedding, when do you need to reverse engineer to start these? About 90 days again on this
90
one?
days.
Okay. And so really when we're collagen stimulating, it's going to take some time to get that collagen to do its job. So
Correct.
3 months out is when 3 months prior might be when you want to start these treatments.
And I want to add, you can do microneedling anywhere. If you are not happy with your scars on your stomach or somewhere on your arms, you can also do microneedling anywhere. Your chest, your neck.
And that makes me think, one of the things, the benefits of microneedling and PRP is some of the discoloration,
yes,
the
texture.
melasma, textures, darker spots. A lot of this stuff can kind of get
Melanin,
find to be more consistent with the microneedling and the PRP. And it's really become such a popular thing because it really has great benefits.
It does.
I am super excited to have you do this on me in the near future. We'll do some before and afters and we'll share them with everyone. So we've talked about some different types of facials. Talk to me about chemical peels. This is something that's always kind of intimidated me, so I'm interested to learn more about it.
So chemical peels obviously is going to take the dead skin off the top layer, but we go a little deeper. So you're going to take multiple layers off. Also, it's the trauma to the area that is the collagen induction and helps with the elastin. So we have different layers depending on which Fitzpatrick you are. It's we do from 1 to 6 Fitzpatrick, but different levels.
And Fitzpatrick is really the your skin tone, your skin color. So from very light shades to very dark shades is kind of divided in the dermatology world between different Fitzpatrick. So I'm assuming some smart person named Fitzpatrick came up with this entire system, but it's what's typically used in dermatology to say modify it for different skin tones and colors. And so are we actually putting chemicals onto someone's face and then that creates like a sloughing of the outer dead?
And you probably won't see any peeling for the first day or so, but then the third day you will peel, and you may peel for a couple of weeks.
And the therapeutic benefit of this is really getting rid of the outer dead, creating an environment for the underlying stem cells to regenerate and replace some of that.
And again, it's for texture, fine lines.
Very important, I think, I forgot to mention on the PRP, you're going to have some abnormal look to your face. You're going to have a little redness on a chemical peel. You're going to have some sloughing and peeling of your skin for up to 10 or 14 days, right?
Well, a little redness for 3 days, not like the chemical peel.
So for PRP chemical peel, 10 or 14 days of possible redness. Okay. And PRP, maybe a couple of days of some redness, but nothing that you have to worry about looking a different way.
Wear your makeup in 48 hours and go to work.
Yes, and you did a PRP on my very dear friend yesterday. She is gorgeous, looked more gorgeous, but by last night I couldn't tell she had anything done, and it had been like 12 hours. So I think for some people, maybe with a PRP, very little changes. Let's shift into some really popular procedures. So that kind of takes us off of like the facial type treatments. What are the frequently asked questions? Well, everyone's heard of Botox at this point. Botox is botulinum toxin, and it goes in and it works to decrease wrinkles. But what's some of the information that you think people should understand and know about Botox?
So Botox is a paralytic. The way it works is it paralyzes the muscle and it relaxes the wrinkles. If you have these droopy lines, you can inject some Botox here, and it reduces the frown and it reduces the lines. You can do it around your lips. It will reduce the lines, and it will flip the lip up, make it look a little bigger. You can also thin your nose by putting Botox in certain areas. Of course, most of us know mostly about the forehead, and it definitely relaxes those lines there and around the eyes.
The coarse lines of the crow's feet, the 11 lines between your eyes, the long lines across the frontalis, the forehead. It helps relax that, because when we paralyze that nerve, it's not pulling on the skin and creating these kind of harsh wrinkles.
Mean looks at your children.
Okay, so that would be important for my child to know. Cost of Botox, I think, is confusing for people, because we typically say it's so much per unit. You can see Botox sold for $9 a unit up to $16 a unit. And then it's like, is it only $16? Because I know that's not right. How many units do people typically need?
Right. Generally, you're putting 30 to 50 in the forehead, less to the bottom part of the mouth. You can even do the platysmal muscles here,
those are the muscles
and
of the
it
neck
helps
that
with
sort
the
of
jowling.
pull out. Yeah.
Helps with the jowling, reduces that.
So if you are looking and your provider charges $12 a unit, then you would multiply that by probably give or take 30, but you really don't know that until you do the consultation.
That's correct.
Yes. Last thing, dermal fillers. Tell me, what are dermal fillers used for and how do those work?
So as we age, we lose the volume in our face. Some people just want bigger lips. So the dermal fillers are designed to increase the volume, which helps with a more youthful look.
And so it is what it sounds like. It's filling. So when we have these marionette lines that are maybe really sunken and we kind of want to pull that back, a filler might help with that. Pulling things a little bit tighter. When you fill one area, it can kind of pull tighter on some other areas. And so many times, aesthetics practitioner, nurse practitioner, doctor, cosmetic surgeon, plastic surgeon, these people are really like artists. They can look at a person and say, hey, a little bit of Botox here, a little bit of filler there. It'll all even out. It'll be much more, I think what most of us are really saying is, I still feel like I'm 30. I want to look like I'm 30. And so, how can I go about doing that? And the fillers and the Botox and the peels are all great ways. And then you and I are big believers of not just going and getting something done, but also taking care of your skin on a day-to-day, trying to reduce your sun exposure, which is going to create more lines, but also
a
using
daily
good
routine.
products. Yeah. And we use we sell the Obagi products, which are great products, but medical grade skincare products, a little more expensive. But, I have a friend who's a cosmetic surgeon, and she says going to the dentist does not replace brushing your teeth. Your skincare
Correct.
product is brushing your teeth, and then coming in and getting your aesthetics procedure is like going to the dentist. And so I think making sure that you have a great skincare
daily
habits,
use,
morning, night, it makes all the difference in the world as well. Thank you, Kathy. I think this helps people understand a little bit more of what are these popular things that are offered. And certainly, if you are interested or have questions, we love to do free consults. Kathy loves to sit down with people and answer any questions or concerns they have.
and to follow up.
Yes, and follow up closely so that if you have concerns on anything, she helps alleviate all of those concerns. So if you're interested in any of this, come in and talk to Kathy, or if you're not in our area, reach out to a respected aesthetics provider in your area at a medical spa near you. We like to leave you on a good note. So today's Tell Me Something Good comes from our beloved employee, Maddie. Maddie, tell me something good.
Something good is travel. I like the fact that we get to go to other places and learn other people's cultures, all while knowing that we get to come back home.
I love that, and I love travel as well. Thank you so much for joining us today, and until next time, take care of yourself.